Okay, so in this section, we're going to talk about craniosynostosis and we're going to talk about hydrocephalus. Both of these are things that can cause deformities of the skull. They can also cause some other issues. So craniosynostosis is when the sutures close prematurely. Usually it's only one or maybe the two that are on opposite sides. So what happens when they close prematurely, as the brain grows, it causes the other sutures to open further or causes the skull to be misshapen. Okay. The majority of kids with craniosynostosis have normal brain development. They just have a suture that closed too early. It's managed by surgical correction. And that surgery is pretty miserable as far as pain, but it does tend to have good outcomes. Now, if all of the sutures are closed prematurely and the head is small, it's called microcephaly, that's usually because the brain stopped growing. So the sutures closed because the brain wasn't growing, rather than the brain stopped growing because the sutures closed. The next thing I want to talk about is hydrocephalus. Okay, so hydrocephalus is when the cerebrospinal fluid that circulates through the ventricles and the spinal cord either doesn't circulate properly, doesn't drain properly, or is not absorbed properly. So I want you to get a picture of what that would look like. Let's find that really quickly. Found this picture just a minute ago. Okay. Okay, so this is normal. This is what the normal ventricles look like. They are spaces, they have fluid, and that fluid circulates. It goes down, surround the spinal cord and back up. So at times it doesn't circulate properly. It's not draining properly. So it's sitting in the ventricles in the brain, and they continue to enlarge, take up more space, and it starts to compress the brain tissue against the skull. So the danger there, the risk there is increased intracranial pressure. So if the sutures are still open, say a young child, the skull gets larger, the fontanelles bulge, they'll have what's called frontal bossing, where the front part of the skull moves outward. Let's see if we can find a picture of that. There's some pretty severe images of frontal bossing here. So we can see the skull's enlarging, this frontal plate is pushing outward. That's because this child has too much fluid, and because the sutures can separate, that makes more room, okay? So if the sutures are open, it causes the skull to enlarge, it causes bulging fontanelles, it causes frontal bossing. If the sutures are partially closed, then the pressure can cause them to reopen, which is pretty painful. If the sutures are closed, then when those ventricles enlarge, it causes increased intracranial pressure. So increased intracranial pressure leads to the setting sun sign, and we looked at that in a previous in that previous video. Sluggish pupils, headache, nausea, vomiting, other neurological signs, okay? So usually hydrocephalus is associated with some kind of a structural defect that doesn't allow proper drainage of the cerebrospinal fluid. It can be, they're also going to be associated with neural tube defects. An infection can cause this because the debris from the infection clog up the channels. A mass, like a tumor in the, a brain tumor can cause it by blocking off drainage, hemorrhage, trauma, things like that. So think about structural things that would affect drainage. So how is this diagnosed? They, when they measure the baby's head circumference, they watch for it to stay on the same curve. If it starts to cross percentile lines very quickly, if it starts to grow very quickly, then they start doing some imaging, and they look at CT and MRI to diagnose it. Management, if there's an obstruction that can be removed, that's surgically removed. they can place a shunt to drain cerebrospinal fluid. And if it's temporary, that shunt may just be like an intraventricular drain. But if someone has chronic hydrocephalus, they actually place a shunt permanently, well, semi-permanently, that goes from the ventricle and drains that fluid into the peritoneum, just out into the abdomen, and it's absorbed. That's called the ventriculoperitoneal shunt, or a VP shunt. Now, as the child grows, that shunt actually has to be replaced because they outgrow it. So that shunt, the ventriculoperitoneal shunt, has to be replaced periodically because of growth. Now, we're going to have usual post-op care for that kid that has surgery, but also during that post-op period, we're monitoring for increased intracranial pressure, because if the shunt malfunctions, that's what we'll see. So we're assessing at all times permanently anyone with a permanent shunt is at increased risk for infection, and they're at risk for that shunt to malfunction, stop draining the fluid, and so they develop hydrocephalus again. So those are things that have to be monitored for. Parents need to be educated about what that would look like. So what does increased intracranial pressure look like? So this kid has a VP shunt, they get a stomach, or they're vomiting. Is it a stomach bug, or is it that their shunt has failed? Okay. And they also need to know what signs of infection in the neurologic system would look like. So lots and lots of family education and support. Prognosis depends on the cause. If it's simple hydrocephalus with nothing else going on, then prognosis is pretty good. It can be associated with cognitive disability because sometimes the same thing causes both things. Now, if hydrocephalus is untreated, it does eventually cause damage to the brain tissue, and so they have cognitive and other disabilities due to that. All right, in the next section, we're going to talk about head injuries.